Here we go. Own your data, own your diabetes, own your data. My Diabetes Home truly has some very exciting features that will really make the platform much more valuable for you. We are taking data in and we are making it more valuable, useful, and available to you at the time that you need that data. So what all kinds of data can we connect? And why is data important? Data has become the new oil. It really is what takes people from point A to point B anymore. It's the next big thing in our lives is data. And it fuels just about everything in the world, including your health. And the more health data you have control over, the more answers that you will get and less questions about your diabetes management. So what kind of data can we get? Well, there are two kinds of data. One is medical data, the things that you will see when you go to a doctor's office, get your blood drawn, or refill your medication from pharmacy. So that's the medical data or health data. And second is the personal health data, like, for example, your blood sugar meter, your weighing machine, your blood pressure machine, or your Fitbit, all of those. Now, we're so excited to say that we can do all of this and bring the data to you. Own your data, own your disease, own your diabetes. So what can you connect to MDH? Well, first of all, blood sugar meters. And that's where I showed you that exciting video of all the meters. You have been logging for a long time. Isn't it cool that you can take many of these meters and upload them? How about activity trackers, the Fitbits and all of that? Weighing scales and blood pressure devices. You weigh at home and it shows up in the cloud. Pretty much everything should reach the cloud is my belief. We should liberate all the data and then use it to help you with your diabetes. Electronic medical records. So meters, these are the meters that we are able to upload right now. So many of the major brands are right here. And I would urge you to go and try and upload. We have a cool competition going on this week. So between now and next Thursday, the next 168 hours, I would challenge you to connect as many of these things. Each thing you connect gets you one entry into our raffle here. What is at stake is an Echo Dot. So Amazon Echo Dot. So I would urge you to connect whatever devices you have and share what you have been able to connect. Just email us, and then we'll run a lottery at the end with an Amazon Echo. All right, fitness trackers. So you walk, you run, all of that. There's no need to log it yourself. We can take the data from your Fitbit, Garmin, the Misfit, the Apple Watch, Google Fit, you name it, and we can bring it up there to the cloud. And once we bring it there, we show you four main things: your calories, miles, steps, and sleep. So this is all available to you right now. Go ahead, take your Fitbit, take your Apple Watch, and connect it. Nokia's weighing scale and blood pressure machine also can get uploaded. All right, so that was all your device data, your own personal health data. And then what about the medical data? This is really cool. So the law mandates, the CMS said, the government said a few years ago, that not only patients should own their data, get their data, they should be able to transmit their data to third parties. And this is how we are able to get your data with your permission from physicians and health systems, large ones like Mayo and VA and 25,000 more. And then the Walgreens, CVS, and Rite Aid, 60 to 70% of prescriptions in the US are written through these three companies. And you can connect those accounts to us and get the data in. The two biggest labs where your blood most likely gets processed or worked on is LabCorp and Quest. We have them as well. So imagine this, having all your labs, meds, conditions, everything in the palm of your hand. I had a patient who went to the ER one day and he was in severe back pain. He could not remember his list of medication. All he did was he took his smartphone out and showed his med list. This is amazing. You do it once and it's with you. So I would urge all of you to have your information available on your smartphone. We have all sorts of information on the smartphone. I could tell you what I had at Starbucks 6 months ago. That's really irrelevant information. What's relevant is what am I doing with my health? What's happening to my health? So again, bring your data to your devices and then make sure it's available when you are receiving healthcare from us. Okay, so many of you might be in Iowa. That's why I chose that we should put together what systems can connect in Iowa. So Broadlawns, University of Iowa, Mary Greeley, Unity Point, and Skiff. All of those you can connect and bring your data in. I would again urge you to bring, and many of us have to receive care at multiple places. So bring your data in and let us know which ones you did, and we will run that contest later on. All right, summarizing, because I really want to hear from you. What are your thoughts? What are your concerns about this? So, hey, if you check your blood pressure or weight, bring it to the cloud. You check your sugars, bring it to the cloud. Own your data. You walk, you run, whatever you do, you sleep, bring that to the cloud. You can bring everything and then watch this data play wonders with your diabetes in My Diabetes Home. Own your data, and then we will make it more useful, valuable, and available for you. So that kind of sums up the what's happening and this excitement around the data. We can cover 210 million unique lives in the US. So chances are something or the other is definitely connected for you. All right, let me take a pause here and see if there are any questions. Cody, are there any questions online?
We had a couple questions. Okay. First one asking if they can connect their Fitbit, and the second one asking if they can connect their EMR. So,
okay. So Fitbit can be connected, as you saw. It's fairly easy. Cody connected his. In fact, the data you saw, it's kind of funny. Let's go back here for a second. I have to show this. So Fitbit, you can connect, and what's interesting is that he was playing Frisbee.
Yep.
Frisbee, what?
Ultimate Frisbee.
Ultimate Frisbee. So there we go. Look at that day. He had almost 30,000 steps. All right. So it's pretty cool to be able to see this data and make sense out of it. All right. Next question. Can you connect your EMRs? Of course you can. There's a ton of them, and you can easily go to My Diabetes Home and connect it. And if you want, I'll show it to you. Let's see how much time we have. We have time. So why don't I take a moment to just walk you through how it is done, and give me a second to pull up an account where I can show it. All right. This is My Diabetes Home, and let me log in. And what you do here is you say connect to portal, and you come in, and oops, an error has occurred. Let's try again. There we go. Get started, and type in a health system. The person who asked the question, type in the health system, and I'll type that one in. Right now, just for the interest of time, let's say we wanted to search for Unity Point in Iowa. So we'll type Unity Point, and let's see, I think Unity Point is a single thing. So there's a bunch of Unity Points. We'll have to figure out which one.
If you take Unity Point Iowa, it should work.
One.
2 words have maybe been there.
Okay, University of Iowa came, and there's our clinic, Iowa Diabetes and Endocrinology Center. So Iowa is bringing a bunch of things, University of Iowa. So not sure why Unity Point is not coming up right now, but again, this is the way you would do it. So search your system. So let's say you were going to University of Iowa. You will come here and you will put your username and password, and I don't want to do that, and then you can go ahead and do that. In case you needed help, you could actually click on this and go to their website and do what you need to do there as well. So it's all linked nicely for you, a lot of information that you can get out. And once you get it out, it will come back to My Diabetes Home in about 72 hours or so. And then you only have to do it once, and then it continues to bring the data in general for most health systems.
We do have a couple more questions coming in.
We'll start one at a time.
Yeah. One was, can specialist clinics be added?
I think, again, I would urge you to go to this same place, Connect to Portal, and look for your doctor. So in fact, what you can do is either you can do a hospital clinic, or you can even go like this. So let's see, if I want to search myself, let me see if I'm there or not. Well, those are all my relatives, maybe not, but So a lot of Bhargavas come in. Probably I'm not here. So that's the way you would search. I would urge you to search, specialists or not, if they have enabled the system in the way the government wanted and CMS wanted, we should be able to get them. So go ahead, search it out. That's the best way to figure it out. Next question.
The second question is related to the video you showed earlier. How would one get involved in the vaccine study being conducted about lowering A1Cs through the tuberculin vaccine?
Okay.
Would I have to do this for my diabetes doctor?
So the question is the BCG vaccine. How can someone get involved in that? First of all, it's only for type 1 diabetes, right? So that's first thing to remember. Second, the study itself had 52 participants. The study is being done in Mass General, okay? So that's the only center that's running. They have a phase 2 trial running as well with more patients, but that's the only way. So after this webinar, Cody, we have contact information for our attendees. Yep. We'll send you a link to an article. At the bottom of that is the email and contact information for the folks from Massachusetts. So we'll follow up with that. And in fact, if you find it, we can just put in the chat box now. But either way, we'll let you know. And let's see, other questions.
No questions so far.
All right, then I can resume. I had some other exciting things to talk about. So there's more to talk about. There always is. Our team, so let me just talk about our team. So we have, it's a small team, but a mighty team on the other hand. Cody, our marketing manager, Grant Oz, our client success manager, and we'll bring their photos at some point. Of course, you can see them on our website as well if you're logged out. Then we have the unsung heroes, 6 developers, software engineers in India, our CTO and our dev manager. They're all worked really, really hard over the last 6 months to make massive updates to My Diabetes Home. And I think you'll be pleasantly surprised how good it looks and also what's coming. So on that note, what's coming? Let me talk about a few new features. So back to the presentation. All right. New features, some cool things we want to talk about. So there are too many numbers in diabetes: A1C, blood pressure, cholesterol, the 4 types of cholesterols, the sugars. There's just too many numbers. I have been struggling with those numbers for the last 20 years and say, what about if there was one single number? And we built this thing called Diabetes Score or DISCO. And it is based on how many ABCs you do, the A1C, blood pressure, cholesterol, and how often. And then you get the score every month. And then we also do a cumulative DISCO. I really do believe there's a reason why I brought one number in. I do think this number, especially your number, the cumulative DISCO or total, could really determine your health, your risk for hospitalization and complications. So I would urge you guys to put in more information in the platform and you'll see your DISCO soar and your health improve. This is what it looks like. Each month you get a score out of 100, and then you have one total DISCO throughout the lifetime you are with My Diabetes Home. And nobody else is doing this. This is something really cool that we have been able to build. What else?
One question asked was
Please.
What a good DISCO score would be.
So the question is, what would be a good DISCO score? In general, I would say anything above 50 or 60 would be good. The second thing I would say is that we launched this recently. We, over the next 6 months, are going to measure the data and then actually give you much better information on what that DISCO is. In fact, we'll bring in percentiles and we'll bring some gamification. Like different levels you reach, you will get some different awards and points and get free days of subscription. So I would say stay above 50 would be the first impression I would have. We will remember in our future webinar towards the end of this year to update with what changes we make to DISCO. Great question, thank you. Moving on, you know, I've been wanting to be on the site and the team here finally made a virtual avatar for me. So there I am, Dr. B, I'm on the website, and our goal really was to provide very specific information exactly when you need it. So for example, you're an A1C and you're saying, what's an A1C? Then I'm right there to help you on the site 24/7. I'm right there. And we did one for blood sugar targets, and we're bringing a few more. So this thing will keep becoming bigger and bigger, and I think you'll enjoy these videos, and more importantly, learn right when you need to learn. Oh, and there's one more thing. Within a few weeks, we'll have Alexa. So my belief is every sugar reading needs to reach the cloud. That's when it becomes much more useful. But we can't do it because some of the meters don't connect, and logging is hard. So we said, why don't we bring our friend Alexa into the mix? Alexa, open My Diabetes Home.
Hello, let's change diabetes together. You can add your blood sugar by saying, add my blood sugar.
Add my sugar.
What is your blood sugar reading?
110.
I heard 110. Is that right?
Yes.
What time was your reading taken?
7 a.m.
What date was the reading taken?
Yesterday.
Did you take your blood sugar before or after eating?
Before eating.
I have logged your blood sugar to my diabetes home. Your blood sugar is in the American Diabetes Association target range. Great work.
I think we are getting closer to the end of our time with you today. All right, folks, thank you so much for joining. My summary take home today: own your data, own your diabetes. Let's change diabetes together.